Supplies of medications Albuterol and Adderall are short. The former is commonly used to treat breathing problems, the latter to help those with ADHD. Local 3's Abigail Martin spoke with a local pharmacist about the shortage. She joins us now with what she learned. Abigail.
Greg, currently the FDA's website says over 100 drugs are in a shortage. Of those, Albuterol, Adderall, and drugs similar to Adderall are listed. There has been a shortage of those two drugs since last October. A local pharmacist says drug shortages are not uncommon.
Typically, they're not drugs that are really common like these two.
Phil Smith, a pharmacist at Access Pharmacy, says there are over 100 drugs on backorder at any given time. Typically, Albuterol and Adderall are not on the list. He says he cannot get a straight answer on why the common medications are on backorder. The FDA lists a demand increase as the reason Adderall is in short supply. Their website does not provide a reason for the Albuterol shortage. Smith says people use Albuterol for asthma and COPD, chronic disorder pulmonary disease.
It can't be cured, so they just kind of treat it symptomatically with albuterol and steroids and other things.
Smith says those with COPD and asthma naturally have a harder time during allergy season, and he hopes the issue will be resolved before then. He says Access Pharmacy is teaching people how to use inhalers as an alternative. Smith says people with extreme COPD should continue to find the nebulizer solution. If the shortage continues, Smith says his pharmacy will make necessary changes.
We might have to reserve anything that is available for people who are severe, who need it the most.
Smith says the Adderall shortage has caused issues with other medications to treat ADHD. He says this affects the everyday life of patients who need it. Smith says typically people only consider children to need the ADHD medicine, but he says the drug can act like a lifeline to kids and adults alike. Smith says there are other options for Adderall, but they may not be covered by insurance.
Typically, it clears up pretty quick. The United States is pretty good with dealing with these things.
Smith says he hopes the pharmacy can go back to where it was 6 weeks ago, where he could place an order and have confidence the medicine would arrive the next day. Live in studio, I'm Abigail Martin, Local 3 News.